indeed.
Did you like the high-tech intro?
It's really nice. It's fancy. I said, not tipsy Tuesday. That's what I saw. I was like, well, it's 5 o'clock somewhere, and it's literally
It's
5 o'clock on the eastern side. Eastern
that's
side. Unfortunately, I don't have any drink, but I've got water. So yeah,
I love it.
that's tipsy Tuesday for me.
I love it. First of all, let me just say a proper welcome. Everybody, first of all, welcome to Slice of Pie Tipsy Tuesday. If you have a cocktail, knock it out. If you don't, it's all right. But I am so excited that Mohamed is here, and we're going to get into some conversations around InovCares. And for those of you who are catching the live or you're catching the replay, we're so grateful for you pitching in, joining in. Please love, like, and share, and do all the things that influencers tell you to do so that we'll keep coming back. But before we get too far, I was thinking about in my intro, and there's some people that I have cheat sheets for and some people that I don't, but I do want to make sure that I touch a little bit about what InovCare is and finding out more about your journey and how you got here. This is really, really important, especially as we're talking about the maternal health crisis that is going on, not just in the US, quite frankly, but also for Black women, African-American women that look like me, and the kind of the way that we've been dealing with healthcare and some of the support services that your organization and your company has. So we're going to be able to talk about a lot about that. But I honestly, when we met, it's been months now, and I was so enthralled by your journey and why your company came to fruition. So let's just start there. Tell us a little bit about who you are and how did you get to InovCares? Like, how did that come to be?
Yeah, great question. Thanks, Shelley, for inviting me on this and just having a dialogue. Funnily enough, I mean, in the background right now, as I'm hearing, I was like, oh, wow, it's meditation. Hopefully I don't fall asleep in the meditation chair. So we'll do our best to stay up. It's almost my bedtime. That I 8 o'clock, 8:30 is when I will fall asleep, and I wake up in the middle of the night. And then continue my walk that I do. That's a side note. InovCares itself was birthed because of my sister and my aunt who passed during childbirth. My sister was living in Sierra Leone. She died of pregnancy hemorrhage, and it was her fourth delivery. She didn't make it, and the child didn't make it either. So I became caregivers for those kids. And then my aunt died of preeclampsia in Columbus, Ohio, and this was her second delivery. Thankfully, the son survived, and she previously had twins. And so my dad and my stepmother became caregivers for those kids in Columbus, Ohio. And so that's what really jumpstarted the journey to really, how do we connect women of color going through their birthing journey to the right clinicians that take the time to understand their unique need and they are proactive in supporting their needs, right?
Yeah.
And that's the key, right? It's not just the culturally competent piece, but also clinicians that actually are proactive in providing the right resources, which can mean the connection point to the right clinician, the support group, the knowledge, right, which is very key in the education side, and just information that will help identify the risk factor before it gets too drastic, where it may be a little too late to save that mom and their child. So we are very much on the prevention side as well.
Wow, I was wondering what your thoughts were around maybe the misconceptions that I think a lot of us still have, that for the most part, if you're in the US, you have access to care. It doesn't mean you have access to good care. I mean, just be quite frank, okay? I have, as someone who's worked in the space where I've always had my healthcare taken care of by one of the big organizations, it doesn't necessarily mean that I'm getting the best care. And there are a ton of articles, and y'all can Google these, testimonials and stories about women of color who are dying every day because they don't have access to the resources, or they're not getting care, or those types of situations are still happening. And I wonder what your thoughts are around the misconception that it's not happening as much, and it's not something that should be top of mind. What do you think about that?
Yeah, great question. I think one, it's an access problem, but the other part is the clinician that touched that patient, right? It's also a quality side, and ensuring that clinician is very receptive to the demographic that they're serving, and they're actually wanting to serve that demographic. They check their biases, because that's the thing, right? That's like
Yeah.
you have the best plan, the best. Maybe you're with Blue Cross Blue Shield, United Healthcare, any of these big plans, right, that support you. You have insurance or Medicaid even, but when you walk into the hospital for delivery, or even let's not even go even there delivery. Let's just say you are wanting to get pregnant, and you're having, well, usually we refer to as infertility. Um, and you just need some support around that, and you have a physician that's not being very supportive and giving you the right knowledge and solution for you to help you get pregnant, for you and your partner to get pregnant. So for us, we had a unique patient even, right, that came and walked to our door. And she was experiencing infertility. She had an OB/GYN physician that was being highly dismissal of her need. And this is a
Mm.
well-educated woman, 33-year-old nurse by trade. So extremely smart, clearly well knowledgeable, well paid, had an insurance. She worked in healthcare as well.
Yeah.
Um,
Yeah.
Experiencing infertility, and she had an OB that was being highly dismissal of her need, and she found us and wanted a second opinion. And that part of that, for part of what we did was connect her to that physician, OB/GYN physician, Dr. Alowodi, who provided that second opinion for her. And we facilitated that connection point. He spoke to her, told her a treatment plan for her infertility, but then as well was very proactive in continuing to follow and help with her. And 2 months after, she actually then reached back out to the clinician, Dr. Alowodi, and said that she's pregnant. Then 9 months after,
Wow.
the child, John, was born alive and well, right? So seeing that transferred, you can say it's the notion around access, because that mom is on Medicaid and or may not have insurance. That's 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 not the case. Like that is a barrier, but it's usually not the case. Even the wealthy with the most knowledgeable, they have the best insurance plans, still struggle with
Yeah.
um, infertility and birthing right successfully as a brown and black patients. And you take the classic case of, as well, of like Serena Williams, and she experienced complication during pregnancy. Serena Williams, I don't think there's a cost to that she can afford it.
Yeah.
I'm pretty sure she can afford it. She probably has the best of like the providers. But again, it's around making sure that you have the right provider that go the extra mile and actually take the time to understand the uniqueness that you are a person of color. You have certain risk factors already, and they are
Right.
keen on those risk factors, right? They're being proactive. Have we gone in and checked in for all of this risk factor? If you're not pregnant, have you completed all your prenatal visits? And are there any risk factors that we're identifying early, like hypertension? Maybe your diet is a problem, where your current diet before your child gets here, you are eating a lot of salt, right?
Yeah.
Which salt, if you don't take care of that part, it can lead to elevated blood pressure, which leads to hypertension, which is a form of, and you take that hypertension, you kind of taking another step, which can lead to preeclampsia if it's not identified early, right? Which is a form of complication during pregnancy. So it's a ripple effect.
So if I'm walking through the process, so again, I love the fact that you pointed out that it's not necessarily a Medicaid versus Cigna, Blue Cross, et cetera, right? It's not necessarily a carrier.
It's not like Medicaid or commercial.
Yeah, or commercial. So that's not necessarily the barrier. The fact that you talked about the risk complications and even having some of those conversations, I do take the point where, I would be more comfortable seeing someone who understands even some of the cultural aspects about, having a child or infertility. And I think within the African, I'm Jamaican, so I'll say Black because that's how we're Black. So don't get offended, y'all. I do mean African American as well. But in our community, even to have those infertility conversations, there is a cultural sensitivity aspect to it that is just not as simple if you don't have an understanding towards what some of that's coming from, right?
Yeah, and let's just call it that what it is. It's usually a taboo, right?
Yes.
In a community to say, because oftentimes once you get married, you have your mama, your dad,
and you're on a clock.
What's next?
Yes.
When are you gonna give us grandkids?
Yes.
Ma'am, I just got married. Can I enjoy my wife or my husband? Take my little time. Maybe in 2-3 years, maybe we'll think about living kids. Into our marriage. But no, you're on like this clock when you're married now, and if you're both and your partner, you're trying, but you're struggling to get pregnant. That's an uncomfortable conversation.
Yes.
That oftentimes the woman doesn't have, right? A safe space to have this conversation. And we create that safe space. We have a community. Again, part of what we do is there's a support group that women can actually create for each other. And that a woman that may have experienced similar condition can then access that support group as well.
Okay.
And so it's that safe space for most taboo questions that oftentimes in our community becomes very uncomfortable to discuss. So now, if a woman is being very vulnerable, you should commend her, right? She's being brave, especially for the in the community, our Black community, other brown community as well.
Yeah.
To come out and said, yes, I am struggling. We're getting we are struggling because it's not a burden. It's not a burden only for the woman. It's also a burden. It should be a burden that the men carry too. But knowing that the two play a role, right? The man and the woman play a role in birthing a child. It's not pain and the struggle should not be only solely on the woman taking all that stress that it is me. I'm infertile and I'm having an issue getting pregnant, and it's because of me. No, maybe the strong level of the man may be a problem as well, right? So it's also being able to have these dialogues that break down the taboo conversations, so openly have conversations around, hey, yeah, I struggle with it too, infertility. How do I get support? Or maybe I have experienced preeclampsia before, and I'm a survivor. How do I pass on that knowledge as well to my community? So it's really just breaking down the barrier for having these open dialogues that are usually very taboo.
That is so incredibly important because it does become very, very lonely very quickly. We went through a phase, my husband and I, where we were, my daughter, she's 14, but we had 3 losses before her. And to that very point, there was no community of support. If had InovCare been around 14 years ago, it'd be a different story. Where for me, I would know, okay, here is a community that I can go to. That's not my family telling me to get over it or don't work. You know what I mean? It's not. It's very lonely, and there's so many women who are going through this right now, who are looking for a way to even have a community that they can be vulnerable with and share, their experiences with. And then on top of that, to have access. So can you talk about how do you get, like, if I wanted to get in alignment with InovCares, like, what is the process like? How do we get your service?
Yeah. Yeah, we support the healthcare providers that are providing these services. And so we, as a mom, if you're thinking about pregnancy or you're already pregnant or you've delivered, now you're thinking, okay, how do I take care of this child? Am I going to do traditional breastfeeding, lactation?
Mm.
So if you've never breastfed before, but you need some guidance around that, you've got access, or you can easily open up the app. It's an app based, both a patient app and a physician app, but it's an app based. Find you a lactation consultant that's culturally competent, sensitive to your needs, so that you can get access to lactation consultants. Or if you're going through that birthing journey and you need that extra support beyond your OBGYN physician, right, that's providing that, and you want access to a doula, you can get access to
Mm-hmm.
doulas, right? And say you after you deliver, because oftentimes the mom is forgotten after the delivery, that sometimes it can be challenging just after delivery, being able to take care of a new human,
Yeah.
a new life, and your body's changed, and you're questioning a ton. We like to sometimes that can even show itself as some symptom of postpartum depression, right? How do I get access to a support group, peer-to-peer support group, but as well as clinical psychologist, psychiatrist, right? Mental health specialist. So we think of supporting the whole mom rather than a subset of the mom. So that's how you can access some of the resources on the platform.
And I love the fact that there's an app that I can go. So there's an app for everything, y'all. And I love the fact that there's an app that you can go to for healthcare and also, consultation. Obviously, it's easy to access all the resources, but here again is the app that gives you access to the community and the support that you need. There is such I love that the fact that it's accessible in doing it that way. Again, for the moms who, you're thinking about, if you're thinking about, getting pregnant, having a baby, etc., and you're going to your OBGYN, you're having those free discussions, this is where you still need to get the app now. I don't wait
Yeah.
until, the day comes, because this is where I think you can go in at least and start getting access to some really good resources and start joining the community.
And even as a so essentially, you say you successful deliver and you just want to stay healthy. That component is there as well, right?
Yeah.
So for us, what we do for just just a woman trying to stay healthy is that
Yeah.
support group. Part of that is we can you can go on bike rides, we track your steps, and then whoever has the most steps get points. Point turn into rewards. So we incentivize you for adopting healthy behavior, because 60% of the the complication during pregnancy are preventable, right? And a lot of that stem from cardiovascular conditions that affect mom during pregnancy. And so if you're just a woman trying to stay healthy and one in that support group, especially it's the new year.
Oh yeah.
Everybody has their goal. Everybody
Everybody has
has
a goal.
their healthy goals. So we support that, right? There is a health
Yeah.
assessment that you can do at home, and that health assessment itself really captures data on the patient, corrected BMI, risk factors, right? They have diabetes. You know, so infuse a lot of nutritional guidance, a health score that you work towards, and then now you have that group that gamify that well-being. So you being able to stay healthy, you on points, what are your points, and reward is a discount on your virtual visit. So
Oh, wow.
Yeah, it ties back into you being able to have access to clinicians on a discounted basis because you're staying healthy. So we want to encourage you to stay healthy throughout your life cycle as a woman in general, right?
So so say you've gone through um, prenatal and now into postnatal. What does postnatal support look like? Are there access to like counselors, or is that built into the community? What can folks who, so for example, like for the moms who may have had their babies and they're just finding out about InovCares now, what kind of benefits would they get in getting the app?
Yeah, part of it is the fact that again, mom just want to stay healthy, right? They want that support.
Yeah.
That's one, and that gamification piece that I alluded to. Secondly is the postnatal period. So postpartum period can last up to like a year, right?
Yeah.
Sometimes even more. And there is also sometimes there is such a word as postpartum depression or
Yeah.
other condition. So you can get access to like psychologists, psychiatrists. Maybe there's some issue around your marriage, right, or your partner, and you need to just have a private conversation, right, with a third party, a psychologist, psychiatrist to help with make sure that hey, what I'm thinking through, the problems in my mind, I'm not crazy. This is normal.
Yeah.
To have a dialogue with a trained professional, not your best friend forever. But yeah, your best friend forever is definitely important as well. That's part of your support group. But your best friend is not a clinical psychologist or psychiatrist, so they're mindful of that as well. That
Yeah.
they can provide a lot of support, but not a professional judgment. So you get access to that professional judgment from a mental health point of view as well, and then access to primary care doctors too.
Okay. So we covered the client side or the patient side. What is the experience like for the healthcare professionals? How do healthcare professionals get involved with your app?
Yeah. So doulas or OBs that are providing this clinical services, and they want to support their patients before a visit. So let's take a classic case of Dr. Alwoody, right? When he provides care here, but he has had a platform, and the patient Matthew was wanting a second opinion to connect with a doctor that looked like him, that has that cultural sensitivity. He has his own app, right? There's two apps. So one that's specifically for professionals. He can do what he was able to do is he can add in his practice detail, which is his practice
Okay.
detail, set his time when he's available, set his own rates. He also has the ability to e-prescribe, which means he can prescribe medication, and that we have an on-demand pharmacy that delivers the medication to now in 50 states.
You deliver the prescription to the clients?
Yes,
So you don't have to. Oh,
we
wow.
mail order that directly to the
Okay.
patient home. Mhm.
Okay.
And so the physician will prescribe the medication on the physician app. Patients will get a notification it's been prescribed. They can go on the patient app, pay for the medication, or use their insurance, and then the medication will be mail ordered to the patient's home. They can track it when it gets to them. Once they receive it, it also tells them when to take the medication and how often. There are different alerts in the app as well, so kind of do a little bit of medication management. And then for moms that are in the pregnancy, right, and in the pregnancy itself, and they are looking at how's my child doing, how's my child
Yeah.
coping? Like child alive, so that we can prevent a lot of stillbirths. There's a virtual ultrasound as well.
Wow.
You can be at home conducting the virtual ultrasound, and you can share that imaging with OBs. And then for those people, for those in-person visits, we allow you to be able to, for the clinician or the case manager, to book rides to and from the clinics as well. So that's what we do for the provider side.
That's a lot. That's a lot of services. I was also thinking about if you are a physician or BGYN, if you're just starting out, especially for the ones that are operating in their, kind of their own office space, they're not tied into a larger group of doctors, that this is such a great way for you to deliver service to your patients through the app. And the app is so easy, it's easy to use. And as I mentioned earlier, we're all on the apps, so it's not a situation where we're not familiar with it. It's just so much more easier. It's accessible. You have everything that you need on the app, exactly. And you can tie into this community. There's a lot of, and again, especially within our community, Black and brown folks, because, if you don't, you're not trying to drive to an office someplace. A lot of us can't, we don't have the time to do, what I mean? All of that. It's very easy for you to connect to doctors and nurses and counselors and a community of other folks who are sensitive to our specific cultural needs, and they are very evident. I know when I am meeting with my OBGYN and I have to explain things about just my own culture, it's not as simple as people think it is. You do feel more comfortable, being treated by someone who understands that, this is, I want to get the full service the same way you give it to somebody else. So having somebody there to support you. So I want to switch a little bit on InovCares, because while I have you here, and y'all, he's very soft-spoken, but he is, a lot of folks want to talk to Mohammed. I just happen to have him. So I'm going to take some time to get some insight from your perspective about where you want to take your company, and what are some of the things that you're doing now, and how do you stay motivated and all those things. So where do you see your company going, and what are some of maybe a couple of things that you're working on right now that you're excited about?
Yeah, it's a great question. Usually when you start a company,
I'm mini Oprah.
So you're wearing so many hats, right? As you start a company, and to answer that question more succinctly as well, it's the activities now. Overarching goal for us is, right, we want to impact 1 million women going through their birthing journey successfully, in order for us to improve their birthing journey, and the improve the NICU stage and maternal deaths, right? So we have key metrics that we measure, and some of those key metrics that we ultimately measure are the percent of reduction of preterm birth, right? Reduction of C-section rates, percent of increase in women breastfeeding, percent of those that are enrolled in our tribe or secondary groups post-partum for mom support, and a number of women that are enrolled or referred to social determinants of health services, like warm handoff to like food, wig, contraception, and a percent of women identified as high risk to receive 2 home visit, etc. Right? So those are some of the key metrics that motivate us, that we measure, and so those are, when you think KPIs, usually people use those words, but those are things that keep us grounded. And so all the company's activities towards that, right? Towards that direction. It is, if I always think I was sharing offline here, if it doesn't move those metrics, then I tend to not do. Will not engage. And so oftentimes it's that metric. It's like holy grail on my in my office here, and if it's not moving, so some of the thing as well as a founder in tech, it's like you have to fundraise, and so that's part of another thing. That's one of my jobs. Wear a few hats, few jobs, but that's one of my job, fundraising and making sure that we can hire the best people that really believe in this mission and really want to serve women. So fundraise, hire the best people that really are wanting to support women of color as they go through their birthing journey successfully, and giving them the best care So really being able to identify the right people that really are passionate about that, and then of
Yeah.
course they are good at their job too.
Right.
It's important.
Quality.
Yeah, that's important. But again, it's not just they're good at their job; it's also do they care about this,
Yeah.
which is the motivation aspect you alluded to. What motivates you? It's because I inherently there are people that I'm supporting back home, my sister's kids, and my aunt's kids that are here in Columbus, Ohio, that are vivid of the reason why I do the work. I wish their moms are alive because that's something important that they're not getting, though they're getting, of course, the support from my parents as physical mom, but their mom would have been so much more better being here,
Yeah.
right? To have that mother's touch, that mother's guardians, but they're forced to grow up without that.
Yeah.
And that's painful. And so for me, my motivation is I don't want another woman and their children to have to experience that because I know that firsthand and that's painful. And I have conversation with my niece, and most of the time, sometimes I should break down and cry. And it's part of
Yeah.
that. Right? I wish I had my mom here. Um, so that's what motivates me. And I think when you think what motivates the company and our mission, it's beyond us. It's really how do we make sure that there's a comfort level in women because it's always scary to deliver to
Yeah.
bring a child into the world. That thing is scary.
Oh yeah.
And how can you foster a community and a safe space so that they have the support and they can think of one less thing to do, right?
Yeah.
And they can just focus on bringing that beautiful life to life and having that mother child bonding relationship and that joy that the pregnancy should actually bring, not the fear that crap, I might die.
Yeah.
My child might die because of a bias of a clinician or a bias of a health system that I'm going to deliver my baby in.
I think one of the things that, well, two things that I admire the most, I admire a lot about you and your organization, but the two things that I admire the most is at the very heart of what you do, it's saving lives, and you're very passionate about that. And I mean, it's very obvious in the way that you built out the model of your organization, the way that you built out the app and making it again accessible, so that folks can get to participate in the service. And then the second thing that I think I admire the most is that you're putting thought. So we before in the green room we were talking about entrepreneurs versus business owners, and I tell people all the time, I'm a business owner. I might have ideas, but I'm a business owner because I intend to build jobs and pour back into the community through different ways, scholarships, endowments, all of those things, and make an impact and influence. And what I appreciate about what you're doing, you're of the same mindset. It's doing good work so you can help people, and helping people motivates you to keep doing good work. And so I wonder what do you want to be remembered as or by? Like, what do you want us to, you look back at all of this and you're like, what do you want to be remembered for?
I just care. And this is usually they say your passion or your calling finds you. This is one of those that I was not sitting on a cubicle keen and be like, I just maybe I should go solve this problem. I become rich. It wasn't that.
Right.
It was one of those. It happened twice in my family, and I'm forced to and genuinely care because I was birthed by a mom, and people that are delivering, it's brown and black people as they deliver, they look like me. They look like my mother. It's a struggle as they go through their birthing journey, and I hear those stories over and over, how complex and how difficult it was as they go through their birthing journey. And if I can be, our organization as a whole can be that light, that comfort, that's what drives me. And plus, for me, I'm very much faith driven as well. And so in the work that I do, and hopefully bringing a little light to the world makes moms happy, and give them one less thing to worry about, so they can just focus on the joy, because it should be a joyful experience. Because
Yeah.
Even though, of course, the pushing of the baby is hard. This is I mean, we're going
The
through
labor
it
part.
all. There's all the difficulty of it, the pushing of the baby,
Yeah.
and after you deliver, wearing diapers. It's the reality of it all, right?
Yeah.
So that's the hard part as well. But once you're seeing that baby take their first step, should be joyful. Their first smile when they are alive, and then you have that support. That should be a joyful experience for yourself, your family, and a lot of joy that beautiful angel will bring to the life of your entire family. And that's what motivates me, and hopefully that's what I'll be remembered for as well.
Oh, well, you definitely will be. I am so honored and grateful that you joined us. Before I close out, I just want to give a quick reminder and hang out. We're gonna be in the back room with at the after party. After this, there's no after party, it's just us. Don't be jealous, y'all. But I just want to make sure that I remind everybody, please go to the website. The links are in the chat. Go check out InovCares. If you're a mom, a dad, a cousin, an aunt, an auntie, an uncle, whatever, if you know someone in the family who is currently pregnant, thinking about it, if you're a girlfriend, you're in your girlfriend's circle, you're at church, whatever it is, please make sure you share this information. Again, especially in Black and Brown communities. I don't even want to pull out the Google numbers, y'all, because they are terrible. Okay, so there is a reason that there is a need, especially in our community, and also giving people a chance to build a community with other women who are going through these really stressful conversations of how to carry a child and safely and securely. So please check out the website. Mohammed, I am so I'm so just like, I'm a fan anyway. I'm a huge fan, and I'm so grateful that you gave us your time. Y'all, if you're an investor listening, please make sure you go check out the site as well. Let me just drop that. Okay, serious investors only. All right. If you're a doctor or a nurse in the healthcare field and you're interested in also being a part of this app, please go ahead to the site and get all the information. The team will reach out to you. So we'll tell these people deuces while we hang out in the back room. And thank you so much for being here.
Awesome. Thanks for having me, Shelly. This has been fun.
Awesome. All right. Bye, y'all. And we'll hang out in the back for a second.